Hello. In this video, we will give some tips for the communication skills stations of the OSCE exam. This is specifically for MRCEM or FRCEM exam, but it is also applicable to all OSCE exams. Communication skills are very important skills for any physician. Communication skills are used nearly in all stations of the OSCE exam, but they are tested in stations designed specifically for testing these skills. I mean, in history-taking stations, for example, you use your communication skills, but in the history-taking stations, you are tested for your ability to take history well from the patient. The main points are given to you when you cover the history-taking items. In contrast, in communication skills stations, the main points are given to you when you use your communication skills to communicate properly, regardless of the subject that you are communicating about. And to know the different communication skills stations that you may find in the exam, think of your work, and think of whom you communicate during your work. In your work, you communicate with many different people. You communicate with the patients, the relatives of the patients, the other doctors, the nurses, etc. So, in communication skills stations, you may be asked to communicate with any one of those. Also, there are different purposes of communication. These include speaking to an angry patient or relative, breaking bad news to a patient or a relative, obtaining consent for a procedure, explaining a clinical diagnosis, speaking to a nurse addressing any problem, speaking to a colleague for handover or difficult referral, etc. So many different communication skills may come in the exam. And here too, as we have already done in other videos, we will give you some general items that you can use in any communication skills station. So, in communication skills stations, you will meet a person or a role player that you should speak with them for a purpose. And you do not have to memorize specific items for each purpose. And you can memorize certain items that are applicable to all communication skills sessions. In the beginning, you will have 1 minute to read the scenario that will ask you to speak to another person for a specific purpose. From the scenario, you will who the person is and the purpose of speaking to them. So, you will start with the steps that should be done with all types of stations. Those steps are as follows. Read the scenario outside. Knock the door and enter the room. Greet the people in the room. Wash your hand. Introduce yourself. Confirm the identity of the person that you will speak to. Those steps should be done in nearly all types of stations. Of course, some steps are not applicable to some stations. You will discover this yourself. So, when you read the scenario and the questions, you should know clearly what is required from you in the station. For example, you are called with your CPR team to resuscitate Mr. John, who was found not responding. CPR failed and you should meet his wife to tell her that his husband has passed away. This is the scenario. After 1 minute, you should enter the room to perform what is asked of you within 7 minutes. You should enter the room, greet the examiner and another person. The other person may be a patient, a relative of a patient, or a colleague. In any case that you should any clinical data related to a patient during your conversation with the other person, you should review the notes of the patient. So, after entering the room you should ask the examiner for the notes or the file of the patient to review it. Then, you should wash your hands. Use alcohol sanitizer to wash your hands. This step may not be applicable here, but no worries. Then, you should go to the other person, introduce yourself, and confirm their name and their relation to the patient, if this other person is not a patient. For example, you may say, "Good morning, I am Dr. Michael, emergency medicine physician. Please tell me who you are." Again, the previous steps should be done nearly in all stations, where applicable, not only communication skills stations. Before we continue to the items of the communication skills stations, I would like to give you some general tips. The first tip: in most stations, you get the points of the station when you do specific steps to cover specific items. But in communication skills stations, you get most of the points when you communicate well. So, the most important thing in communication skills is to show good communication skills, which we will mention in the following tips. Another tip: keep calm. Do not be angry or irritable. Do not respond aggressively to the person to whom you speak, even they are angry or aggressive, or attacking you. Another tip: do not interrupt. When the other person talks, you should listen carefully and let them speak until they finish what they want to say. Another tip: show sympathy. When the other person says to you information that requires sympathy, please show sympathy. Do not behave or talk like a robot. Another tip: use silence properly. When you tell the other person shocking information or information that requires them to think of it, allow time in silence for them to understand and react to the information. But do not be silent for a long time when this is not needed. Another tip: never give false information trying to decrease the anger of the other person or to make them not attack you. Now, let's continue to the item of the communication skills stations. You have read the question outside, entered the room, greeted people, washed your hand, introduced yourself, and confirmed the identity of the other person. Now, you should start to speak to the other person, fulfilling the following items. Start the conversation. Listen. Respond. Listen. Respond. And continue to listen and respond till the end of the station. These are just simple items like the items of any conversation in general. But the content of the conversation depends on the subject of it. So, you should have a good background about the subject of the conversation, so you can continue in the conversation. But unfortunately, you cannot memorize specific responses for each subject, because your responses should depend on what the other person says. And of course, you cannot expect what the other person will say exactly. But you can know a general background about the common subjects that may come in the communication skills stations. The first step is the most important step. You should start the conversation correctly. And in this step, you should invite the other person to speak to know their knowledge about the subject of the conversation or to know the issue that they have. This is because, in communication skills stations, we have two types of stations. The first type is the stations in which you have information that you would like to tell the other person, such as breaking bad news or explaining a diagnosis. The other type is the station in which the other person has a problem that you should solve, such as speaking to angry patient stations. In either type, you should invite the other person to talk first. Because in the stations in which you should provide the other person with information, you should know first about their knowledge about the subject. For example, if you would tell the patient about an unexpected diagnosis, you should know first what he knows about their condition till now. And in the stations, in which you should address a problem that the other person has, you should invite the other person to talk first to know the problem. So, the first step is to start the conversation by inviting the other person to talk. This may be not applicable only to the difficult referral stations, in which the other doctor does not know anything about the patient. Then you should continue the conversation according to the responses of the other person using your clinical background about the subject of the station. And the most important thing is to follow the rules of the communication that we have already mentioned. Then, in the last section of the station, you should finish the station by doing the following. Ask the other person if they have any other questions or concerns. Offer help if applicable. Thank the other person and leave. Now, let's mention some points about the most common communication skills stations. Of course, the steps are nearly the same, and you will be assessed in terms of the rules of your communication skills. But the contents of the conversations will differ according to the subject of the conversation. So, you should have good knowledge about the common topics that may come in the exam. Let us see. An example of communication skills station is speaking to an angry mother because of giving her minor daughter morning after pills. And giving morning after pills is a method of contraception after having unplanned sex. In this station, you should start the conversation by asking the mother about the problem. You may say, for example, "How can I help you?" Or "Please let me know the problem that you have." The mother should tell you the problem and you should listen carefully, and you should follow the rules that we have mentioned. Then you should explain what should be always done in these circumstances. And you should tell the mother that this was done according to Fraser guidelines. Then you should answer any questions or concerns that the mother has. Another example is speaking to an angry mother because she thinks that her daughter was treated by an incompetent doctor. In this case, after listening to the mother, you should explain the case of her daughter and what has been done to her. You should not blame your colleague. And you should explain what should be done in this case and in the future to manage this problem. Of course, in these cases, you should have reviewed the notes or the file of the patient after reading the question outside to be aware of the details of the case. Another example is breaking bad news to a patient or a relative about death or a bad diagnosis. In these cases, you should also have known the details of the case well. And you should ask the other person about their knowledge about the case. Then you should provide the bad news explaining what has happened and showing sympathy. You should allow silence and time for the other person to reflect. Also, in the case of death, you should also ask regarding organ donation, and also offer help. Other examples of communication with patients include explaining new diagnoses, giving information about treatment, and obtaining consent for a procedure. In either case, you should do the same steps nearly as we mentioned. But the information that you will provide will depend on your knowledge and experience. However, you do not have to say all details. You should say the most important points in a simplified way. This is because you will be assessed on your communication skills mainly, not your clinical knowledge. But your clinical knowledge will guide you during the station. Another example of communication skills stations is difficult referral stations. In these stations, you are asked to speak to another colleague on phone to refer a patient. In this case, you should explain your position properly, then you should allow your colleague to explain their position. If no agreement about the case is obtained, you should tell your colleague that you will call your consultant to contact their consultant. Note that in the communication with colleagues, you should be organized and professional using solid medical information. Not just simple data is what is used in communication with patients or their relatives. These were some examples of the communication skills stations. Try to think of other examples and practice different scenarios. Thank you and see you in the next video.